Hello and good afternoon friends, welcome to CEC-UGC live lecture. Dear friends, as you know that we have conducted a series of lectures on cancers. We try to understand about various kinds of cancers, how they occur, what are the treatment, what are the remedies with the help of which the cancer can be treated or operated. Today also we are going to talk on a very important kind of a cancer, and the cancer is gastrointestinal cancer. And for this we have again with us in our studios Dr. Majid Ahmed Talikoti. He is a Senior Consultant Surgical Oncology. So first of all I would like to welcome our guest Dr. Majid, and I hope that the way he has delivered the previous lectures and made us aware about the cancers on a whole, I believe that this session, this lecture also would be going to one of the productive lectures, productive sessions. So first of all I would like to welcome Dr. Majid. Dr. Majid, welcome to the EduSit lecture. As the name suggests, gastrointestinal cancers, I could predict out from the name itself that it is somewhere related to the intestines, if I'm not wrong. So over to you, sir.
Yeah, good afternoon. The topic today we are discussing is the gastrointestinal cancers. If you see gastrointestinal cancers, they include the cancers occurring in the gastrointestinal tract, like whatever we eat through the mouth goes to the esophagus, then to the stomach, and from there to the duodenum, small bowel, then goes to the cecum, the ascending, transverse, descending colon, the rectum and the anal canal, and it is excreted. The path along which the food travels from oral cavity to the anal canal, from where it is excreted, all this is the gastrointestinal tract. The common cancers occurring in the gastrointestinal tract are of the colon, the stomach, the esophagus. We will discuss about the most deadly, dangerous cancer, the stomach cancer or the gastric cancer. Discussing all the gastrointestinal cancers may not be possible. We will go directly to the stomach cancer, which is also known as the gastric cancer, which in the world, if you see, the stomach cancer is the second common cancer in men and third commonest cancer in women in Asia and the whole world. Nearly 1 million new cases of stomach cancer are detected and nearly 8 lakh deaths. That means 80% of them die of this disease. If you see in India, it is the 5th most common malignancy in the males and 7th commonest malignancy in the females. But if you pay a bit of attention, it is the second commonest cause of cancer death globally. Means people dying from this cancer is very common, so it is a very deadly disease, and people also call it as captain of death. As we all know that in cancers, what exactly happens? What is stomach cancer? We have already discussed that cancer means an abnormal cell which keeps multiplying with no function, with unlimited expansion and growth. If this type of growth occurs in the stomach, the cells from which they arise is the lining of the mucosa. This uninterrupted, unwanted, functional less growth in the stomach leads to a gastric cancer. And what will happen if this abnormal growth occurs in the stomach? A tumor of 1 centimeter becomes 2 centimeter, 2 centimeter becomes 4 centimeter. Then the whole of the stomach, the lumen of the stomach cavity gets obstructed. There is an ulcer from which it bleeds. This is gastric cancer. And the cancer not only stops there, as we all know, the definition itself says the cancer goes a little more and spreads to the adjacent areas, that is from the stomach to the pancreas, from the stomach to the spleen, from the stomach to the neighboring organs like the liver. This is the local spread. And not only this, but the lymphatics, the blood vessels which are carrying blood, which are carrying lymphatics from the stomach, they carry these cancer cells like as if they have been transported, and wherever the blood goes, they spread these cancer cells. For example, by the hematogenous spread, it goes to the liver, it goes to the lungs, it goes to important organs of the body like brain, like the bones, and ultimately all these organs get dysfunction, they go into organ failure, and ultimately the person dies. This is what happens in stomach cancer, in the gastric cancer. Now, we have seen recently that the incidence has started to decline of stomach cancer all over the world. Why? This we will come to know as we go deep into this lecture, where we will know what are the etiological factors, what causes stomach cancer. For example, because of the improved food hygiene, sanitation, and food preservation techniques, this decrease in incidence globally is occurring. Why? This decline is not occurring in some parts of India because of poor food hygiene, poor sanitation, and poor food preservation techniques. This is the reason why we have seen that there is a decline all over the world, but not decline in certain parts of India. If you study the demographically, where stomach cancer is common. Stomach cancer is present even in South India and also in North India, but more rampant, more cases are identified in South India. And the disease in South India occurs a decade in advance. This gastric cancer is notorious and has a high incidence of local and distant recurrences. It's an aggressive disease. In India, Mizoram is a state where you get the highest number of gastric cancer patients in the world. And we also have seen that in Mizoram, more than 30% of the cancer is contributed by only the stomach, the gastric cancer. Why is it so in Mizoram? We get the highest number of cancer patients. What is the problem? What are the etiological factors? Why Mizoram is getting the highest number of cases? Similarly, in Kashmir, you get more cases of stomach cancer. Why? What is the reason? We will come to know as we go a bit detail into the etiological factors. What causes stomach cancer? Why stomach cancer is occurring? And how we can overcome it? How we can prevent it? How can we make this deadly disease, which is the second leading cause of death all over the world? Whether stomach cancer, is it more common in males or is it more common in females? Yes, it has been observed that stomach cancer is twice more common in males as compared to females. What is the age group in which we get this gastric cancer, stomach cancer? We all know that cancer is an aging disease. As age advances, we have seen this similarity with breast cancer also. We have seen this similarity with oral cancer also. And what is that age? That decade is the fifth decade, that is between the age of 50 to 60 years. We get this gastric cancer. What age group? It has seen through studies that males get it at the age of 58 years, females at around the age of 57 years. Can younger people get stomach cancer? Yes, it is common in this fifth decade, it is common in this age group, but yes, we have also seen stomach cancer patients at the age of 20, we have seen at the age of 40, we have seen at the age of 50, that there is no age bar. Anyone can develop, but commonly it is seen in that age group. And the younger the individual, the aggressive is the disease. The complications are the disease. We normally get the diffuse type in the younger age group, which is more aggressive and more fatal. Just think, why this stomach cancer? What is the etiology? What causes stomach cancer? What is the function of the gastrointestinal tract? If we just think, the function of the gastrointestinal tract is to take care of the food what we take, to absorb the nutrients and give energy to the body, to take care of the metabolic activities. This gastrointestinal tract. So what could be the cause? The main function is the food. Yes, it is the diet which is responsible for the cancer. Then should we stop eating? No. We need to modify the diet. The most important etiological factor, the most important cause for stomach cancer is the infection of the stomach. Infection of the stomach? Can infection cause cancer? Many people ask this question. Yes, infection can cause cancer. If you see among all the cancers, 10% of the cancers are caused by infection. If you see the CS cervix, the most common cause of CS cervix is an infection with the human papilloma virus. People ask, a person doesn't smoke, doesn't drink alcohol, he was such a this, but still he has developed oral cancer. Infection by human papilloma virus, which we see usually in US and all that, it causes oral cancer. You have not chewed tobacco, you have not smoked tobacco, but you can develop. Similarly, those are viruses, but you will be shocked to know a simple gram-negative bacterial infection, which we call the Helicobacterium pylori, which can easily be destroyed. How? By simple antibiotics. That Helicobacterium pylori is a culprit, is a main cause of stomach cancer. How does a person develop this infection? Can you, me, anyone develop this infection? Yes, by poor sanitary habits. You do not wash your hands properly before your meal. You take contaminated food. You drink water which is not healthy, which is infected. You can develop the infection of the stomach by the Helicobacterium pylori. You will be shocked to know that more than 50% of us are infected by this Helicobacterium pylori. When this infection stays for long, is there inside the body for a long time, then what will happen? This infection can spread, can give rise to gastritis. I will explain you that exact cycle in the further slides. Is it not shocking that simple bacterial infection of the stomach leading to stomach cancer? So we need to keep ourselves clean. We need to have proper sanitation. We need to have proper disposal of our wastes. That's why the Swachh Bharat of Narendra Modi ji can also save you from stomach cancer. So important why we need to be healthy, clean. Cancer, health, cleanliness all go along. So we need to prevent ourselves from infections. The main virulent factor is CAG-A gene, which is in the bacteria. It is a simple gram-negative bacteria. As I told you, it spreads simply by poor sanitation, dirty water, improper washing of hands. How do we come to know whether I am infected by this infection or no? Can we come to know? Yes, it's very simple. We do an endoscopy, take a small biopsy, then we do the rapid urease test, or we can just do a culture, or we can send this for histopathology. We can do a PCR and an ELISA test. What this test will help us know? This test will help us know whether we are infected by this bacteria or no. What if we are infected? 50% of us can be infected by simple antibiotic course of a week. Kills this gram-negative bacteria. The infection subsides, the gastritis subsides, the risk of stomach cancer also subsides. after the infection, as we were discussing, the main function of the GI tract is to take care of our food, the diet. Diet is one of the important culprits among the etiological factors. If you see grossly the etiological factors of cancer, if tobacco is 40%, diet itself is also 30%. If you modify your diet, if you take a healthy diet, 30% of your cancer risk of all cancers can be controlled. That means you can be cancer free. You can save yourself from cancer. But it is amazing. No one in the world and everyone in the world needs food, diet. And without diet, he cannot grow healthy, he cannot grow strong. And I am talking that diet is a cause for a cancer. Yes, it is. Do you know in Kashmir why stomach cancer is more common? People there don't drink. People there, their diet, if you observe, because of the climatic condition, very cold temperatures, they have a habit of taking salted tea. It is a tea which is made of salt, and everyone in Kashmir takes this. For this, which they call it as namkeen chai. This namkeen chai has been one of the culprits for stomach cancer in Kashmiris. And one more thing with the Kashmiris is, people in Kashmir, they take red meat. Red meat, it is one of the important culprits. Should we not take red meat? Red meat taken in excess is one of the culprits for the gastric cancer. After Mizoram, we have the Chennai, Tamil Nadu, southern India, where we get more cases of stomach cancer. Why? The food habits. If you have been there, I am also from South India, there people have a habit taking more rice, and they have that hot rice and sambar. Eating food which is very hot, which has high temperature, means taking hot food. The high temperature food is also one of the culprits for stomach cancer. Other than this, the pickles. Some people have a habit of taking a lot of pickles. Pickle also has a lot of salt. It has a lot of preservatives. All this together can be quite toxic and can be one of the reasons for stomach cancer. Pickled food, salted tea, high rice intake, spices. Some people have a habit of eating a lot of chilies. They enjoy it. Chilies, spices, if taken in excess. Why all these causes? This all cause irritation of the gastric mucosa. And there is a chart which I will show you how all this together damage the gastric mucosa, how they cause gastritis, and you land up with stomach cancer. These etiological factors also hold good for other GI cancers like the esophagus, like the colon cancer. Some people have the habit of using baking soda. Soda which is added in the food. This is also not good for. It is also seen that it has been studied that it is one of the etiological factors for stomach cancer. any food that is fried to turn it black or burnt, barbecue, that is charred, or food that is dried and preserved, all this, like the smoked dried red meat, salted dried fish. Fish, the white meat, is good for health. It is recommended, white meat. But when it is salted, when it is dried, anything that is, charred, barbecued, roasted, burnt, is not good for your health. This food can be toxic, may be one of the cause for a person to develop gastric cancer. Don't consume the food when it is very hot. Don't consume very hot tea, very hot, anything that is very, very hot. Some people have a habit of taking very hot things. High temperature foods, as discussed, are not good for your health. Salt in excess is not good for your health. High consumption of salt is not good for your stomach. It can lead to stomach cancer. All these foods, they cause damage to the gastric mucosa, leading to gastritis and increased cell proliferation. If all the damage occurs, maybe you avoid, you quit taking, then maybe there may be healing. Your body immunity may lead to healing, but at times this may progress to dysplasia and then to cancer cells. Malnutrition, nutritional deficiency leading to pernicious anemia. Anemia can be one of the cause, one of the etiological factors for stomach cancer. Do you know which blood group people suffer from stomach cancer commonly? It is the A positive blood group people, in whom commonly gastric cancer is seen. All the dietary factors, what I was telling you, how they can damage, how they can cause cancer, what is the basics behind, I would like to, diagrammatically or show you. The diet, which is low in vitamin, like vitamin C, E, and the diet which has high salt, and at the same time, if you have the helicobacterial infection in the stomach, what will this do? Your immunity is low, you are taking a high salt diet, and also you have an infection. This all together play a role and convert your normal mucosa into chronic superficial gastritis. If your infection goes off, your immunity improves and your diet changes, this may change back to normal. In case this cycle progresses, then it will lead to atrophic gastritis. This will go a step ahead. The cells go into change, intestinal metaplasia takes place, and then the normal cells begin to change to abnormal. The dysplasia, the premalignant condition comes, and next stage will be cancer. This is how the dietary factors play a role together, and the Helicobacterium pylori, the culprit, how they act and how they can damage your normal mucosa and how you can land up with cancer. We have seen diet, infection. Other than this, there are a number of causes which can cause stomach cancer. One very common factor, the tobacco, we discussed in detail in oral cancers. But today I am going to repeat that. Why? Because tobacco is such a big culprit in cancers. You see what relation tobacco has with stomach. But it is one of the important etiological factors to cause stomach cancer. Tobacco can cause stomach cancer. Is it not alarming? Yes, it is proven beyond doubts. Which form of tobacco? The tobacco taken in any form. Tobacco consumed as a smoke, tobacco consumed in a chewing form. You know, in Mizoram, there is a special way of taking tobacco, that is tubur. I think that tubur is basically a fluid of tobacco which a person inhales. And that's why in Mizoram, we have seen stomach cancer, tobacco contributing to stomach cancer. Before going to tobacco, just to say about something about the red meat. Red meat is not good for health. Do we need to completely avoid it? There are some people who take red meat in the morning and evening. Those people should be more cautious. They should change their habit, decrease the red meat content per day. Diet high in red meat is dangerous, especially the red meat which is preserved, which is barbecued, is not good. And what is good in diet then? What should we eat? We should eat the diet as we all Indians were vegetarians, and the stomach cancer incidence was also very low. The diet which is rich in green leafy vegetables, innumerable vegetables are there. You can take all the vegetables, fruits. You know, a person who consumes 50 grams of fruits per day decreases his incidence of gastric cancer by 17%. That means fruits is good for health. Pulses. Take these innumerable pulses, the soya. Other than this, fruits which are rich in vitamin C, like oranges. Some medicines like aspirin, these are all protective. I was talking about tubur, tobacco smoke infused with water. This is also, you know, in Mizoram, this habit is there. In Kashmir, the hookah is there. All this, you see, wherever this is there, the incidence of stomach cancer is also quite high. So we need to delete tobacco from our lives for a healthy future. Other than that, the other etiological factors are alcohol. Yes, alcohol is dangerous, especially it acts as a mediator. Tobacco with alcohol is much dangerous. If you see, every 1 out of 2 who uses tobacco will develop cancer. Out of 4 who smoke and drink, 3 will develop cancer. Maybe cancer of the oral cavity, maybe even cancer of breast, maybe cancer of stomach. These are very notorious etiological factors. Can stomach cancer run in families? If one member of the family develops stomach cancer, can other member of the family develop stomach cancer? See, if you have seen diet, the diet of nearly the whole family members is the same. In family, if many are taking alcohol, other than this, there are genes which run in families. But this is not 100%, it's around 5 to 10%. So those families in which stomach cancer, colon cancer is high, these families need to be extra cautious. What do they need to do? They have a higher risk of developing stomach cancer. They need to be cautious. They need to have a screening protocol for themselves and the family members, so that we have seen in a family 4 or 5 brothers, all of them developing stomach cancer. This could be because of the food habits. This could be because of the cultural or the social atmosphere what they have. This could be because of the genes. But this is not 100%. This is just nearly 5 to 10% that hereditary gastric cancer exists. Hereditary disease, it can be up to 5%. And these members of the family need to undergo endoscopy, keep on a screening protocol, get a biopsy. If there is a polyp, get it removed. Modify your diet, your habits, tobacco, alcohol, like that, to safeguard the family interest, to safeguard your life, because stomach cancer can run in families. You see, you might have heard in one areas, like recently it was in news, there's some place in UP where many of them are developing cancer. Why? This happens because of their habits, their environment. Maybe there are etiological factors which could be located to a specific region. It has been in papers, and we have seen, like from somewhere, like for example, from a particular place, people of stomach cancer keep coming, like from Mizoram or from Kashmir, where this is common because of the environmental factors, because of the social culture, the food habits and all that. Now I always like to tell something about tobacco, because tobacco is one of the main culprits, you can say main captain for cancer, not only oral cancer, breast cancer, but also for any cancer in the body. Like that way, a gastric cancer, the deadly disease, the captain of death, for there also tobacco is one of the important reason, etiological factor. Do you know how many people in India use tobacco in one or other form? Guess? We have a population of nearly 120 crores. It has been observed that more than 30 crore people in India use tobacco. That means 1 out of 4. And all this I have told you, 1 out of 2 who uses tobacco will develop cancer. That means if you do not control this, we'll have cancer patients in crores in future. And who are the people? Young school going, college, who are into clubbing. Basically the young adults are more vulnerable to addiction. Our message through this telecast or talk is purely to avoid this preventable, avoidable use of tobacco, because even today more than 15 lakh people die just because of the use of tobacco. You will think tobacco has been used for years. You see, earlier the life expectancy was 50 years. Now the life expectancy has changed. 70, 80 years, everyone lives. And cancer is the disease of aging. Now people are coming in the age of 50, 60, 70. And when these people are going to increase, we are going to see the cancer, in lots and lots. The recent study has shown that in another 10 years, maybe by 2025, the incidence of cancer is going to be by 5-fold. We sometimes feel why this cancer has been not reported. The main reason in India is more than 80% of the cancer patients are in stage 4. Many of them are in rural areas, because cancer is equally common in urban as well as in rural area. In rural areas, there are places where the facilities are less, doctors are less. There, the financial capacity of the people is very low. They do not afford to go to a proper doctor. They are not diagnosed. They go for alternative therapies. They go for alternate treatment, for whom which we call like the quacks, who are not qualified, and they get misdiagnosed. I have seen a number of cancer patients who can be cured, who could be saved, because cancer today is curable, is treatable, it's preventable. What happens is, any cancer takes time from stage 1 to stage 4. By the time the stage 4 disease comes, there is a gap of 6 months. Someone holds the patient and says, I will cure you, and waste 6 months. The valuable stage 1 disease where cure was possible is lost. The patient lands up in the last stage, and there the patient sells everything, tries to save, the patient is not saved. We have to stop all these practices. What I mean to say is, what we are seeing is a tip of iceberg. The cases which are reported are quite less as compared to those what we are seeing. We are talking in lakhs, but the burden is in crores. I mean to say the burden is much, much, much more than what we are seeing. So we need to take a serious action on tobacco. Though action has been taken, many states have banned it, but we need to be much, much, much more aggressive. Harshvardhan ji made during his tenure that where we used to see small writing like a foolishness, कि भाई tobacco kills tobacco. Now he has made it very big. The full of the pack contains that cancer kills. Something like this needs to, come into picture. Since I have discussed about tobacco in my oral cancer lecture, how we can quit tobacco, I would not like to go into detail of it, okay, what exactly chemicals are there, how toxic it is, how many cancers it is going to cause. I'm going to skip that. And how to quit it, that also I have had a discussion, maybe in next lecture somewhere where I may even repeat this. Now moving ahead from diet, infection, tobacco, alcohol, let's go. How will the presentation? It's very alarming to know that. See a stomach 80% of the time there are no symptoms. It is asymptomatic. Means patient is healthy. He's walking, moving. By the time the symptoms come in cancer, it is always and it is never stage 1. If symptoms strike, that means the disease is locally advanced or it is metastatic. The sad part of CS stomach is most of them present in the last stage, and when the symptoms come, when a person starts feeling that there is a problem, it is too late. We are already in a stage maybe that cannot be cured. But what are the symptoms like? The symptoms are like the person loses weight. Why? Naturally, the food is not passing ahead, it is not getting absorbed. Person doesn't feel like eating. He takes little amount, he feels his abdomen is bloating. He feels his stomach is full. Sometimes because of obstruction, he starts vomiting. Sometimes because of the ulcer which is bleeding inside, he presents with hematemesis, means vomiting of blood. He takes food, he has pain while eating. He has pain after taking food because the ulcers which are formed in the stomach, when the food touches it, it starts paining him. So symptoms like weight loss, difficulty in swallowing, there is pain while swallowing, there is vomiting, patient feels that stomach is full. All these type of symptoms we normally see in CS stomach patients. There's iron deficiency, anemia might be there. There may be vomiting of blood, there may be passing of black colored stools. The iron contained in the blood may turn the stools black, which we call it as melena. And if we do a fecal occult blood test, we may be able to see that the blood cells are there in the fecal matter. So, hematemesis, melena, this could be the symptoms. Pain abdomen, patient doesn't feel like eating, feels like burping, feels like there is burning sensation in the chest, which we call it as heartburn. The flatulence, water bash, means the fluid what he has eaten comes back to the mouth, which is bitter, which is acidic, which causes burning sensation. These type of repeated symptoms could be the symptoms of stomach cancer. Not after eating a heavy meal, you just start burping. So that doesn't means with the small meals, having these symptoms persistently. You're also having loss of weight, loss of appetite. All these symptoms could be because of stomach cancer. The person may become progressively weak. He's not eating. A well-healthy man becomes cachexic. Dehydration, general weakness. This could be the symptoms. There are certain premalignant conditions. You do an endoscopy, you see polyps. You see there is a gastric ulcer. Gastric ulcer, unless proven otherwise by biopsy that it is benign, it should be considered as malignant. You need a biopsy to confirm that this is not a gastric cancer. Atrophic gastritis. If a person has undergone some trauma or a surgery of the stomach, maybe because of benign reason, maybe because of a polyp, maybe because of an ulcer, has 10 years later a risk of developing a gastric cancer. Why? Because the trauma, because of the lack of the nutrient deficiency comes in that may lead to atrophic gastritis, and that may lead to a gastric cancer later. So those people who have undergone some surgery of the GI tract need to be on a need to undergo gastric endoscopy and all that, so that if there is any recurrence or there is some pathology, ulcer which is developing, which may convert into cancer, because it is one of the risk factors. Some hereditary diseases like the non-polyposis colorectal cancers, all this also could be premalignant conditions. I have already discussed the spread. What happens? The cancer in the stomach comes, and the lymphatics which are there, the blood vessels which are there, the stomach cancer can spread to the spleen, to the liver, means the adjacent area. This is one type of spread, encroaching by the cancer. Second is the dropping of cells in the blood, going to the liver, lungs, and all symptoms, organ failure. Other is through the lymphatics, lymph nodes, all over the body. Third thing is what happens from the stomach. In the abdominal cavity, they can spill the cells, and the cells can go over the ovary, and a tumor may develop in a ovary. That is known as Krukenberg's tumor. This transperitoneal spread. The peritoneal cavity is one, cells dropping from top may drop down, and in the ovary this is known as Krukenberg's tumor. This is one type of spread. Or what can happen behind the rectum and the uterus, there may be a space where it might be getting accumulated. You do a PR, you feel some soft tumor there. That is known as Blummer's shelf. Sometimes a nodule may be seen. Means how every cancer spreads by direct lymphatic hematogenous spread. How to diagnose a patient of a stomach cancer? It's simple. Do an endoscopy. You see an ulcer, take a biopsy. By endoscopy, you know how much is the lesion, how big is the lesion, which part of the stomach it is involved. And by biopsy, you know what is the pathology, whether it is an adenocarcinoma or it's a lymphoma, whether it's a cyst or it's a carcinoid, like this way. Then clinical examination by palpation, you see whether there is a mass palpable or what. You do the routine blood test to know whether the liver is functioning properly, whether the kidney is functioning properly, because the disease may go there and these functions may be deranged. We do a CCT chest and abdomen. Why we do a CCT chest and abdomen? So that we know where exactly is the tumor, whether it has spread, whether it is to stage the disease we need to do it. Sometimes the CT scan 10 to 20% misses. So it's always better when you are doing or operating on a CS stomach patient, first to put a diagnostic lab, a small hole, put a scope, see if the disease has spread or no. If it has not spread, then open up and do the completion surgery. This is how the lesion looks on endoscopy. If you see this ulcer, what you are seeing, this is how the lesion appears on endoscopy. You will see elevated ulcer. The gastric carcinomas, based on the biopsy, they are classified as 90% of the stomach cancers are adenocarcinomas, 5% are lymphomas, 4% are cysts, 1% is carcinoids or neuroendocrine tumors. That means 90% is only adenocarcinoma. And people have classified based on the how it looks like. Bormann's classified as polypoidal type of cancer, or a fungating, or ulcerated, or diffusely infiltrating, like how it appears on an ulcer on endoscopy. The stomach, like we know, I'm wearing a coat, underneath a shirt, like that way there are layers. Like that way stomach wall also has layers. The mucosa, submucosa, muscularis propria, serosa. When the tumor, why I'm talking about these layers is for staging. Which stage the cancer is, it depends on these layers. If you see the gastric wall, if the tumor involves the mucosa, it is T1A, muscularis mucosa, T1B. If it involves the submucosa or a muscularis propria, then it is T2. If it involves the serosa, it is T3. If it involves the adjacent organs, it is T4. So that's why we need to know the involvement, to what depth it is, because the lesser the involvement, if it is only the muscularis propria, it has not spread anywhere, the treatment is only surgery. If it has involved the lymphatics, then it needs to be a more aggressive approach. You need to do the chemotherapy also, and if it has spread all over, then only palliative chemo will help. This is why we need to know where is the involvement and all. So T1 is the involvement of the muscularis mucosa or subserosa. T2 is the involvement of the muscularis propria. T3 is the involvement of the visceral peritoneum up to the serosa. T4 is the involvement of the adjacent organs like the liver, pancreas, etc. If there are only 2 nodes involved on histopathology, it is N1. If 3 to 6 nodes are involved, it is N2, and more than that are involved, it is N3. Based on the grade, if it is well differentiated, is grade 1, grade 2 is moderately differentiated, grade 3 is poorly differentiated, grade 4 is undifferentiated. Well differentiated, good prognosis; undifferentiated, poorly differentiated means poor prognosis. Thus we come to know how to treat this patient, which is the best modality of treatment. That's why this staging is important, and based on the grade we will know how much the person is going to survive. These are the the near 1 to 6 nodes are those which are close to the stomach, lesser curvature, greater curvature. N2 nodes are those which are near the celiac vessels, which are near the hepatic artery and all, and the N3 nodes are which are along the para-aortic area like that. The closer the nodes N1, a little away the N2, more away is the N3. This also helps in to know the clearance, the prognosis. If the node N3 is involved, away nodes are involved, poor prognosis. The nearby nodes are involved, good prognosis. In the stomach cancer is commonly seen in the body of the stomach, and that is 40%, and the distal part is 35%. And the treatment for surgery is the main treatment for gastric carcinoma, but for early cancers which have not spread to the liver, lungs and all. If the tumor is located distally, we do a subtotal gastrectomy. If the tumor is located proximally, we do a total gastrectomy. If the disease has already spread, we do not operate on such patients because it's not going to benefit the patient. You need to have a margin of more than 4 centimeters and you need to remove more than 15 lymph nodes. You need to, anytime when the disease has already spread, but if there is obstruction, if there is bleeding, you can try for some alternative like putting a stent or making a passage for food, or to stop the bleeding you can debulk it, or just to remove that bleeding part or ligate the vessels. This is the palliative type of surgery what we can do. Okay, so other than this, after the surgery, since this disease is, initially we read that it can reoccur, it can spread, so it is a systemic disease, and for systemic disease in cancer, we have a systemic therapy, that is chemotherapy. It is always better to give chemotherapy after surgery, especially in a locally advanced disease. This chemotherapy, the chemomedicine goes and takes care of any cells in the blood or any other part of the body, thus avoiding recurrence, thus avoiding the disease to come back. This decreases so it helps your surgery to have better results.
The way you helped us in knowing about the gastric cancers, because we are short of time over here, we would like to take leave and we affirm that, as well as we promise that we would be carrying more lectures on cancer so that you could be aware how dangerous cancers are. With this note, I thank Dr. Majid for giving his precious time to us, and in future also we would be conducting same lectures under his able guidance. Thank you, sir. Thank you so very much.